We see the test captions. Thank you, Dynamic.
This is the call to order for the Thursday, October 23rd, 2025 meeting of the Finance and Government Operations Committee. Good afternoon. Welcome to today's FGOC, everyone. My name is Betty Young. I am the chair of this committee, serving alongside co-chair Supervisor Ellenberg. I will turn to the clerk. Please call the roll to establish the presence of a quorum.
Vice Chairperson Ellenberg.
I'm here.
Chairperson Young.
Here.
We have a quorum. Thank you.
Fantastic. The first item on the agenda is public comment. This item is reserved for members of the public who wish to address this committee on a matter within the subject matter jurisdiction of the committee that is not on today's agenda. Members of the public who wish to address the committee on a non-agendized item should make a request to speak now at this time by submitting a request to speak form if you are in chambers, or by using the raise hand icon if attending virtually. We can turn to the clerk. Colin, do we have any speakers at this time?
We have one speaker request on Zoom.
Okay, I'm going to provide 2 minutes, and once the speaker starts, we will close the queue.
All right. Next speaker is Parent. You'll have 2 minutes to speak. The timer will start when you begin speaking.
Yes, hello, good afternoon to you all. I told you guys on many occasions that my kids are being sexually molested and I can't get anyone to help me. I asked District Attorney Jeff Rosen for help. He oversees the Child Advocacy Center, and he has the ability and the authority and the mandate to provide a referral to the Child Advocacy Center to get a screening for them. And he's refusing to do it. Not only that, but he's filed charges against me with the intent to discredit me because my former attorney, Valerie Houghton, and a retired judge, James Towery, they want the sexual abuse to continue. And it's just wrong of Mr. Rosen to be doing this to me and my children. It's wrong. And I mean, now I've seen him, he's lobbying the public to vote yes on Measure A. He wants more money, but I don't think he should be getting any more money. We should be decreasing his budget. We don't know what else he's doing. What is he going to do with this money? How many more children is he going to sex traffic? I mean, Valerie Ray Berry was also prosecuted by him because she tried to protect her daughter, and there are other countless parents who are complaining of the same. And I mean, he's retaliating against whistleblowers, against Daniel Chung and James Sibley. Please, if you look up, if you Google DA Jeff Rosen sex trafficking petition, all those terms together, you'll see in the top 4 results what I'm talking about. Thank you for your time.
And that concludes our request to speak.
Thank you. Just want to make sure I provide this public notice that California law prohibits the disclosure of information related to an investigation of suspected child abuse or neglect. We, the members of this committee, are not authorized by law to speak to the specifics of any particular case, no matter how horrendous the allegations are. California law requires child welfare departments to immediately cross-report physical and sexual abuse of children to law enforcement and the district attorney so that swift action can be taken when needed. The public can be assured that our county takes all allegations of child abuse and neglect extremely seriously. That includes rapid and cross-agency responses to such allegations by the Department of Family and Children's Services, local law enforcement, and the Child Advocacy Center, and the district attorney. Thank you. Okay. At this time, the next item on the agenda is approval of the consent calendar and any changes to the committee agenda. Vice Chair Ellenberg, do you have any changes or movements to make on the agenda?
I do. I would like to pull item 9, which is related to the behavioral health facilities expansion progress. I don't need a report, but would like to ask some questions. And item 10, I will keep on consent related to food service at Civic Center and other county offices, but just want to acknowledge the progress and thank administration. It certainly appears that the Plur coffee cart which has been very popular amongst my staff, has been successful at large, as well as the picnic group lunch ordering system and the fresh food vending machines. I'm looking forward to additional initiatives beginning in 2026, including the Micro Enterprise Home Kitchen Showcase, the Farmers Market returning, and community-supported agriculture farm boxes. So I think you have a hand in all of that work, Megan, so thank you very much. And with the single change of removing the behavioral health item, I'm happy to move approval of the consent calendar.
Happy to second with no additional changes to the consent calendar and the agenda.
We do have one request to speak on Zoom.
Okay, we will provide 2 minutes.
All right, the next speaker is Parent. You will have 2 minutes to speak. The timer will start when you begin speaking.
Yes, I'd like to speak to item number 16. I see, as far as district attorneys in the area that have been listed, they're fairly comparable to the one that, to the salary that we're providing Jeff Rosen here in Santa Clara County. But I was wanting to see if we can reduce that amount by any, by a lot. I mean, $450,000, around $450,000 is a lot of money for a person who is not always representing the interests of this county. I mean, I don't think he deserves that amount of money. And especially when he's spent over the last 4 years, he's spent over $800,000 paying Daniel Chung to not work. I mean, Daniel Chung seems to me like a perfectly good deputy district attorney. He should be working. He's already exemplified that he wants to protect the community. And I mean, so if he's spending all this money, wasting all this money, shouldn't that come out of his own paycheck, out of Jeff Rosen's paycheck? That he's wasting all this money on Daniel Chung and also on a prosecution to cover up serious criminal activity. So I hope we can reduce his salary. Thank you for your time.
That concludes our request to speak.
Thank you, Colin. We'll go to a vote now to approve the agenda consent calendar.
Vice Chairperson Ellenberg.
Yes.
Chairperson Young.
Yes.
Motion carries. Thank you.
Fantastic. We will now move on to our regular agenda. Up first is item 4, which is to receive report from the Office of Emergency Management, Office of the Sheriff, Public Health Department, Emergency Medical Services Agency, and Santa Clara Valley Healthcare relating to planning, preparation, and impact mitigation for calendar year 2026 Super Bowl and Federation and FIFA. Thank you. Thank you all for being here today. You can go ahead and start your presentation and introductions whenever you're ready.
Thank you, Madam Chair, Vice Chair, Dana Reed, Santa Clara County Office of Emergency Management. Thanks for having us back for an update. Appreciate having that opportunity. We've got several of our partners with us today. I will make a few comments as soon as we get our slide deck up and running. We'll get going. All right, very good. Go ahead, Tom. The next slide will work just fine. All right, well, thank you again for having us here. So as we kind of verbalized last time we got together, this is just a representation of the organizational chart. In fact, there's a couple additions to it since we last met, including most recently this morning, we have been informed that there's an additional emergency operations center being established for aviation, which is obviously a critical factor given all the major airports, San Francisco, Oakland, San Jose, and even some of the regional airports like Livermore, Pleasanton, and Half Moon Bay. So this chart continues to evolve, and I think that's what you'll continue to see as we get closer and closer to events, especially to the Super Bowl being the first event in February. Things continue to refine, and we continue to meet and do the planning with all of our partners. So this is just a representation today. So as we may have mentioned before, I mean, there are 31 subcommittees. We participate in various subcommittees, so it's a very large group. It's under the umbrella of the City of Santa Clara. We have monthly operational area meetings that we hold actually here at 70 West or across the street. And actually, we've moved to 2 a month, and that is where all the agencies involved are able to come and do presentations, receive information, and it's a great opportunity sometimes for networking and working out any questions or concerns that may be with the planning process. So that continues on. And then, of course, we've continued to do training and exercise, both local, state, and federal. That continues on as well. So our role here in OEM has been primarily as a facilitator and to bring all the parties together, support them, and work with them. Our EOC will be activated for Super Bowl. It will be activated for FIFA. We will have all the partners in our EOC, and we will also have folks embedded in different operational EOCs throughout the county. And our primary role really is just to support the event jurisdictions or any other jurisdiction that has any other emergency or need that day, inclusive of tracking resources, filling resource requests that are non-mutual aid. Police, fire, and EMS handle all the mutual aid requests. They're in control of those assets, and so they'll have a team available to handle that. So that's a bit of the update. I'm going to go ahead, if you don't mind, we start with the Sheriff's Department and give them an opportunity to share all the planning they're doing. They have a huge, heavy lift with transportation, site security, and the services they provide. So I'm going to hand it off to the Sheriff's Department. Thank you.
Thanks, Dana. Yeah, so within the Sheriff's Office and our responsibilities that we have for the planning efforts for 2026, we're sort of broken off into two groups. Captain Cardoza to my left here, who's going to speak in a second, he heads up our transit portion and security for transit, and he's going to speak about what preparations need to take place from a transportation perspective. But in my role as the Special Enforcement Division, I have all the special teams that may get involved with support of that. And we're also the section that's heavily involved in a lot of the subcommittees and planning. So as Dana mentioned, we play a critical role in ensuring public safety during significant events like Super Bowl, World Cup, and other large-scale gatherings that may take place in the South Bay. Within the Sheriff's Office, we are the law enforcement coordinator for mutual aid in our area, meaning that if another agency has a mutual aid request, they have an incident that becomes too large for them to handle, or if they need a piece of equipment, those requests go through us. Even if that equipment doesn't come from us, we are the area coordinator who goes and seeks out that equipment either within our county or even outside of our county and expand it into the region, both personnel and equipment. So in general, we support regional safety. Like I said, even if those occur in city jurisdictions, we're there to help, and we coordinate with local, state, and federal agencies for unified command and resource deployment. We're active in excess of 10 of those 30-plus subcommittees in regards to hazmat, tactical, aviation, intel, overall planning, and we're also participating in the regional command center that will help, which you saw in the org chart, to help share intel across the region during the event. Next slide. Sheriff's Office Special Enforcement, I actually mentioned all these, but these are additional things that we've been doing to prepare. We've done additional supplemental crowd management training, interoperability training, where we got all of our special teams together and train them in one place, which is something that's very difficult to do and haven't done in a long time. We were able to do that. Like as I said, we participate in the regional subcommittee meetings. We're going to staff the regional command center. Our EOD team, or bomb squad, plays a very important role in this. Being the regional bomb squad, they are responsible for EOD responses, both at the stadium and within our jurisdiction, and also assisting other agencies if they get an EOD call. And then, as I mentioned, we're participating in planning and training with our mutual aid coordinator. Next slide.
Thank you. So as Captain Stream mentioned, the VTA planning section, it's a big heavy lift. The VTA Special Events Committee convened spring of last year. There's been a lot of training, a lot of meetings, a lot of planning with internal and external partners. Currently, we do have a big, huge position and a big, huge component in the Transit Subcommittee, which is one of the 31 subcommittees. Currently, our federal administration, White House Task Force to be exact, two big areas that they're looking at with Super Bowl and FIFA planning in terms of the threats to security, to public health, and just general threats to the community. And that revolves around transit security and issues with drones and UAS. You can see here in some of the bullet points, the collaboration continues with several stakeholders. We are the lead agency for the Transit Subcommittee specifically. Several risk assessments, threat assessments, site visits have been conducted over the last year and a half on the VTA system, which is part of our nation's critical infrastructure. We have ongoing collaboration with the NFL and other federal stakeholders for operations, ensuring transit mobility, all the folks that are going to be using public transit, and then more importantly, ensuring that all the main transit modes are safe when folks are going between the VTA system, BART, Caltrain, so on and so forth. And then obviously federal resource requests at the federal and state level are still pending, and we're working diligently to continue to get those efforts addressed.
Good afternoon. Good afternoon. I'm Dr. Monica Roy, representing the Public Health Department, the acting deputy health officer. So public health has been working closely with our OEM partners in preparing for and thinking about monitoring and response to a variety of scenarios and events. These include everything from bioterrorism, communicable disease outbreaks, in addition to respiratory and gastrointestinal outbreaks, considering also sexually transmitted disease outbreaks, as well as vaccine preventable disease outbreaks, notably measles and meningococcal disease. Also considering how these large gatherings may impact violence and injuries to individuals, as well as substance use in our county. And then lastly, considering extreme weather events that may be occurring during these events and the public health impacts of those. As I mentioned, we're working in three areas or three big buckets. One is currently in prevention planning, considering things like proactive messaging to our healthcare providers immediately prior to the event to make sure that they are thinking about potential travel history and exposures that may be relevant. And then the second bucket is monitoring, and if you can go to the next slide. Our science branch and our epidemiologists are working in great detail and effort on the various ways we can monitor what events might be occurring. So we utilize both early warning systems, such as our wastewater detection, as well as syndromic based surveillance or monitoring. We also rely on reportable diseases and outbreaks that are reportable to the state according to Title 17, as well as information on emergency department visits and hospitalizations. And lastly, we incorporate data from the medical examiner as well as death records. So all of this with the idea of ensuring that we're monitoring for those impacts that I shared on that first slide. Next slide. Finally, our environmental health branch is doing extensive work in food operations, in particular focused on the permitting for events, facilities, and vendors, and coordinating with city efforts, especially with regards to unpermitted food vendors, and connecting with other sanctioned events. And lastly, I'll share that we have also been learning from and partnering with other health departments that have previously hosted large events across the country, including previous Super Bowls. We are also working with other Bay Area public health departments to ensure that we have good communication and response in the event of a communicable disease outbreak that would affect multiple counties. And that's it for me. Thank you.
Good afternoon. I'm Sheila Tuna, the Service Line Director of the SCVH Disaster Preparedness Program. I'm sure you all know Santa Clara Valley Healthcare owns and operates 4 hospitals that include a Level 1 and a Level 2 trauma center and a regional burn center. With these critical services, and as a safety net hospital of our county, SCVH maintains disaster readiness and preparedness to ensure we can respond to no-notice incidents that require the care of mass casualties. With the upcoming major sporting events, SCVH has increased our planning efforts and preparation across all 4 of our hospitals. We have worked to standardize all of our mass casualty and decontamination supplies so that all of our hospitals, including Valley Medical Center, O'Connor Hospital, Regional Medical Center, and St. Louis, have the same disaster supplies that are organized inside mobile trailers that can easily be moved into triage areas around our hospital. We have trained our senior leaders to ensure readiness to open and staff our hospital command centers in order to support emergency responses that may overwhelm our hospital system. We have successfully trained over 450 SCVH staff to be part of our hospital emergency response team. This HERD team is trained to support any of our hospitals to provide immediate response to a disaster or mass casualty. They are trained to set up pre-treatment areas and triage patients based on acuity levels. The nice part is that all members are trained to work at any hospital, regardless of which primary work location they're assigned to. Next slide, please. We maintain CBRNE readiness, which is a response to any chemical, biological, radiological, nuclear, or explosive incident that may occur, that may require decontamination before any patient can enter into our hospital. We are currently training our ED staff to be prepared to suit up in level C PPE and set up decon areas outside of the hospitals. We also recently conducted a HERT training at O'Connor Hospital, where we practiced a real-life scenario where people were covered in a substance and needed to be cleaned before they can enter the hospital. The pictures that you see up on the screen are actually pictures from our last drill that we just did. Rain or shine, it was raining really hard that day, and we still conducted that drill. We participated in several meetings and trainings with our city and county partners, and we've recently met with the NFL medical team to initiate partnership and collaboration for Super Bowl 60 and FIFA. We will continue to plan to review our surge plans and also facilitate additional drills, and also participate in future operational area meetings. We've been very busy at SCVH preparing and planning. Thank you for your time.
Good afternoon. My name is Michael Caban. I'm the Assistant Chief and Assistant Director of the EMS agency and serve as the countywide medical and health mutual aid coordinator. So I'm going to address the concerns related to preparedness on the EMS and hospital side. EMS and public health are participating in various subcommittees. The 4 subcommittees that are listed above, the EMS and medical subcommittee, which is actually a regional subcommittee that includes the city of San Francisco, Alameda County, Santa Clara County, the city of San Jose, and the city of Palo Alto, as all being host agencies for events. The EMS agency is currently the co-chair of that subcommittee with the city of Santa Clara. I'm happy to say that the city of Santa Clara has been a fantastic partner on the public safety side in terms of coordination and their efforts. We held yet another meeting today with the city of Santa Clara related to EMS and medical, which was well attended. And we were able to get some of the major components related to the NFL's plan in place for Super Bowl 60. The other planning groups that are being managed through public health and EMS is the Public Health and Preparedness Subcommittee. That's a little bit of a different subcommittee. So in one of my additional slides, it'll go over the Health and Safety Code and how the Health and Safety Code relates to MedHealth Mutual Aid. There's 17 core functions that are managed through the MedHealth Mutual Aid program that are jointly managed through public health, EMS, behavioral health, and environmental health. So as part of the second subcommittee, the Public Health and Preparedness Subcommittee, we broke up that subcommittee into working groups. So there's a working group for behavioral health, environmental health, public health, and then hospital preparedness. Also a part of the Hazmat and WMD subcommittee that's housed by the City of Santa Clara Fire Department. And then in conjunction with County Fire and the Sheriff's Office, we sit as part of the countywide mutual aid coordinator subcommittee as we start those planning efforts. Related to preparedness, one of the topics that was brought up was related to the mass casualty incident plan. Our mass casualty incident plan was revised in 2019. We made some modifications, unfortunately, after the impacts of the Gilroy Garlic Fest shooting and then the VTA shooting to better enhance the plan to allow for the safe and efficient immediate transport of the most critically injured patients on scene to be transported first. I'm happy to say that we're one of the only counties that our plan actually allows for the transport of 88 patients to our hospitals in county before we have to reach outside of our walls to mutual aid for hospital receiving centers. So we're continuing to plan and review, and we'll exercise the plan in lead up to FIFA and Super Bowl 60. We're continuing to evaluate resource readiness. One of the major components of readiness that we're looking at with Super Bowl 50, we did bring in an ambulance strike team to better supplement the 911 system. For call surge, we're looking at that for Super Bowl 60, as well as we're bringing in a specialized resource in case there was a mass casualty incident to have a transport bus that would allow for the rapid transport of patients from the scene to local hospitals for immediate care. In terms of continued preparedness items, we're continuing to work with the hospitals on a monthly basis to do disaster radio testing so that if we were to have a communications failure that affected internet or phone, we could do all communications and receiving of patients via radio. We continue to do quarterly bed availability reporting, which has the hospitals report out to the EMS agency their bed availability in the various categories that we request. We are bringing a regional program to the op area in November. It's the Med Health Operational Center Support class that actually teaches public health, EMS, behavioral health, and environmental health professionals a little bit more about operating in a department operations center versus in an emergency operations center and the different changes between those, and continuing to bring in the ambulance strike team leader course in the event that we needed additional resources brought in from outside our operational area so that they could coordinate effectively and have good interoperability on our communication systems. Next slide, please. As I stated, the MedHealth Mutual Aid Program is contained under the Health and Safety Code. These are some of the deployments that we have previously had from the Sonoma fires, Lake County fires. The MOAC position represents a single point of ordering for the county for any medical and health resource. So that could be if Sheila is at the hospital and determines that they need additional nurses brought in to the op area. Once we exceed the resources that we have locally, then we'd reach outside the op area and bring in additional staffing from other hospitals, both public and private, if necessary, like we did for COVID-19 response. And then we'll continue to look at the 17 core functions. Next slide, please. As I indicated, we took the 17 core functions that are listed in the Health and Safety Code and broke them down by the owner of that actual program. So as you can see, we've assigned each of those to one of the four heads of the MedHealth Mutual Aid Program, so either behavioral health, environmental health, public health, or EMS, so that those agencies are the lead agency on one of those core functions. That's all I currently have, but can answer any questions related to EMS or the MedHealth program.
Thank you so much, everyone, for this very comprehensive and concise presentation. And I want to turn to Vice Chair to see if you have any questions or discussion.
Sure. Do you want public comment first?
Oh, yeah.
And then we'll come back.
Colin, can we turn to see if there's any public comment?
There are no requests to speak.
Alrighty then. Really, thank you all for the report. It's impressive and both scary and reassuring at the same time. I'm interested to know, I'm just thinking about, of course, all of the spectators coming to enjoy the games and the related events and the city's getting to, focus on some economic growth and development and, of course, orderly behavior. we are doing preparation that we certainly hope never is needed. And I'm curious to know what the budget is around this, acknowledging that it is completely essential. Does the Bay Area, what is that called, Sports Host Committee, fund any of the disaster preparation or emergency preparation work?
They do, but we would have to come back with specifics on that. But they do host they're paying for some of the security and safety issues, but I think that they're in a better position to probably answer that question than we are, to be honest. And I know there is some support to the city of Santa Clara for safety and security.
Okay, so I'm interested to know what the county is spending, just to have a ballpark on what our investment is for these events.
I'll speak on the sheriff's office side.
Okay.
We've put in requests for funding for planning for Super Bowl and FIFA. Those budget requests did not come through. They were denied. So right now, we are doing our training based on the budget that we already have, which is not ideal, but we're doing the best we can with what we have.
So the regular sheriff office budget is absorbing
Correct.
to the...
Correct.
Okay.
So, within my special teams, for example, I have training budget, and I'm trying to operate within that and push it as far as I can to be prepared for these events. As far as the actual events themselves, I talked about my EOD team, for example. They have, we have an MOU with the city of Santa Clara to where if they're working on site at the stadium, that money is being reimbursed to us. So there's not a general fund impact there for actual game day and preparation operations. But the planning, there is some general fund cost that is being put into that. And if the worst does happen, as you mentioned, there's absolutely going to be an effect to general fund.
Thank you. And what about on the medical side? It sounds like you're stockpiling potentially essential, and again, hope not needed supplies.
Yeah, I can address a little bit related to the EMS aspect and the med health aspect.
Sure.
We invested quite a bit of time and efforts prior to Super Bowl 50 in preparing for a mass casualty incident on both the public health, EMS, and hospital side by establishing field treatment trailers, or MCI trailers, that are strategically positioned throughout the county to be deployed in case we had a major incident. So that's already been funded. Unfortunately, it was funded through state Homeland Security grants when it was robust. Those grants are not as robust as they are currently. What we are seeing funding for from like the Bay Area WASI or some of the other larger training groups is they're paying for the actual training here, but not for the personnel to attend. So that's at the cost of each of our agencies, unfortunately.
Thank you. Again, I'm not suggesting that any of this is superfluous in any way. Just curious to know, because of course we don't have a revenue driver for this event. Restaurants, businesses, hotels, that's not part of the county gain. And you said Santa Clara, the city contributes. Can you just explain that again? Santa Clara City contribution to law enforcement?
So at the stadium, we have an MOU with them to where when our personnel work at the stadium,
got
and
it.
in this particular case, it's probably going to be limited to our EOD team who have to provide those services for the county.
Got it. Okay. Thank you all very much. I appreciate your answers to my questions.
Thank you, Vice Chair. I'd like to follow that same line of questioning for our public health department and our health system. If, with all the surge and our resources being expended to prepare and possibly respond to any type of actions or activities that require a public health and hospital response, God forbid, has there been any reimbursements, grants, or additional sources of revenue to cover these costs?
For the Public Health Department, currently, our planning efforts are coming from within our own budget. There are some federal programs, such as the Federal BioWatch program for bioterrorism, that's actually been completely halted. They've agreed to open up, 2 sensing sites, a small part of what they normally do for the event, but that's the extent of where we're at.
On the hospital side, we took a lot of supplies and disaster supplies from the COVID operations that we managed during COVID. We took that back to our disaster warehouse, so we continue to build off of that. As Mike mentioned, we did receive some funding and some grant from some Homeland Security funding and UASI grant. We still have some that are pending out there. We don't know for sure if those will be fulfilled and granted, but those will also support our preparedness for these events that are coming up. We, as a disaster team, were able to build our capacity by training our disaster team, who goes forward and trains the staff as well. So we've been able to build our capacity within to do training of our staff across the hospitals.
And to address surge, Supervisor, we have been working with each of the hospitals, not just the county facilities. So far to date, we've visited 9 of the 11 receiving emergency departments, reviewed their surge plans. They're required to submit their surge plan to the EMS agency yearly. So we have reviewed those and reviewed their decontamination plans, and are working with the various hospitals to address any of their decon needs that they're not able to address with a private vendor, by utilizing fire department resources if available for a mass decon incident as well.
Thank you. Before I continue with my question, I just want to express my profound appreciation and gratitude for the work that y'all do every day, and the level of preparation and thoughtfulness has gone into preparing for this year of Sports Bonanza. What my original request for this presentation came from a general sense of worry, because that's our job. We worry about the county. We look for things to worry about. When we run out of things to worry about, we find more things to worry about, and things that we worry about land before us when we least expect it. But it came from a place of general worry and concern to basically ask the question, are we ready? Are we ready for millions upon millions of people to enter and descend upon our fair county and our cities? And are we ready for that? And the conversations since then, in preparation for today's presentation, and bookended by today's presentation, I have full confidence that we are ready. This is the most skilled, highly trained workforce in any county jurisdiction, and I have full faith and confidence that the people coming to Santa Clara County for all the sports are going to be in the safest hands. Since then, my concerns have now shifted, so maybe my view shifts a little bit too, away from preparation, but to the impacts, the compounded impacts of HR1, a surge in costs, additional resources that may or may not materialize, as we are already preparing for the worst financial state this county has seen in decades. I know that we didn't ask for the games to come. The process by which the bids were submitted for these games did not include our input. And at the time that these bids were submitted, I want to be also fair, HR1 was not a reality on our horizon. But we are where we are now. The revenue generated by these games will greatly benefit our cities, and I'm glad for them. That's something that's important to me as a policymaker. It will not come to the county. Very little of it, if any, will come to backfill the costs that will be incurred to be prepared for the safety and well-being of every single person coming through our county. So I give you my greatest appreciation, gratitude, and just also understand the immense sense of pride I have in our county, in our safety net services, our healthcare system, our law enforcement, emergency management. Just, I know from both personal experience, being in the EOC at one point in time, and also now as a policymaker, having a bird's eye view and a 360 view of all information, both confidential and public, we really truly have the best team. But now I turn my attention to our county executive's office to understand how we mitigate. All of our conversations thus far, and also especially through our special FGOC meeting, very, very sobering meeting, that we are our budget is being ravaged by HR1 and the impacts, and we are talking about whether service lines, service lines will still be available. We're talking about whether our workforce will still have a job with the county. We're talking about whether emergency departments will still be open, have beds, whether ambulances will still be on the road. And that's during a time of non-sports. That's just the new baseline of landscape. How are we preparing, or have we been also including all the additional costs that comes along with probably the world's greatest sports like season everywhere, anywhere?
Thank you, Supervisor. Let me just say, I really appreciate you raising this issue and really recognizing the talent that we have here and the immense effort that this takes. And I think, what I can say is that you can rest assured that we will be accounting for all of our costs related to this and looking at every opportunity that presents itself to go after and apply for funding. And, based on our experience with past events and things that we continue to, seek out, we're aggressive, and we will let them tell us no, and seek out every opportunity. But I think you have really hit the nail on the head here, that this is a big lift, that we don't know where the funding, is going to come from, and it probably will not come from an outside source. But we will continue to be aggressive in those, in every opportunity. And I do think too that this is another area where having great relationships with other jurisdictions and with our state legislature and our federal representatives, that if there are opportunities, we have those relationships and can build upon them. But you've certainly, raised the concern, and we don't have a choice but to be prepared, because that's who we are and what we are here to do and to serve. And I don't know if if Dana has anything else that he would like to add to that, but I just want to acknowledge we are in uncharted times. The Super Bowl is taking place during a different time in our county, and in also what the federal funding landscape looks like. And it would not be prudent to not acknowledge that, which is why I really appreciate you giving voice to that concern. But Dana, I don't know if you want to lean in.
No, thank you. Thank you for all the accolades and the comments. Yeah, I mean, you're right. We are prepared. This is what we do. We've done it for other events, other times, and we all come together. I think one thing that's in our favor is that we do, because we've prepared before. So for example, back to the budget question, which is a great question, by the way, it's really unsure about the funding, quite frankly. Like other agencies, my partners at the table and other departments in the county, I'm doing my part through my own budget, and we're making that work. And we do track every cost, by the way. That we have a SIO, and we track all the costs. The other thing that we have also with OEM is that we do have assets that we can deploy if needed. We have emergency generators, lighting, signboards. If something terrible happened in the field and the sheriff's department reached out and said, we need some support in the field with some type of sheltering, we have fully enclosed tent systems that have lighting and HVAC systems that we can set up. We've got tables, chairs. We have huge access to cots, emergency cots, supplies. We've got shelter support trailers that are in place. And we have other equipment and other assets that we can bring to bear. A lot of that has been built up over the years and paid for with grants and budget requests. So what I'm confident about is that we can do the job. We'll all be together. We'll probably have over 60 personnel in that EOC on Super Bowl game day and for every game day during FIFA. And we've got great partners, and a lot of those partners aren't even here today. SSA, roads and airports, so on, other jurisdictions will be embedded with City of Santa Clara. will be with the City of San Jose and the RCC. I mean, we are really going to be on top of this. And sometimes it's pretty complex to explain all of it, and there's, so it gets a little jumbled a little bit, but as we get closer and closer, things are really coming into focus. But we are ready. But there's always that uncertainty, and there's always that what if, like, well, okay, that sounds good, Dana, but what if? And that is what we are preparing for. But we do have quite a bit already at our disposal because we have done such a great job before. And definitely we, came out of COVID with a lot of things that we held on to and that we're using effectively and that are available for us. So we're ready. I mean, we're ready. We'll be there. We're always there. So thank you.
Thank you, Dana. I have no doubts that we will be ready. And really, the second half of this comment is directed more to administration. I worry that in the process of us being ready and being in, because we have to be, period. These games are happening no matter what. And as a county organization and the values of this county, we will always come to the rescue. In the context of our current budgetary financial realities, I worry that the expenditure of resources, which is necessary on this, will further drive the deficits on the back end, which we're already facing significant deficits. These deficits will translate into layoffs. These deficits will translate into service lines being cut, into budgetary shortfalls. I know that it will result in targets in the next fiscal year for both Object 1 and Object 2 reductions in our county departments. Those are people, those are staffing, and I really would like to hear from the county exec's office and a report back. And this can come at mid-year as well. A clearer picture of the financial impacts of the work that we're putting into this, our methods and all the, just an inventory cataloging of where and how we can find reimbursements. We're tracking every dollar cost, who will we send that to? And then just really having a sense of the dollar amount of what's being added to our budgetary shortfall through the preparation of for the games.
Absolutely. I mean, I think that makes a lot of sense to just come back after the event and we'll coordinate something for mid-year. It may not be as detailed as, some of the stuff takes some time to unravel, but I think that makes a lot of sense. And certainly, I think the transparency is really important to our community and to in this time, in this place, because like you said, this is not really the story that gets out there. So we really appreciate it a lot.
Yeah, thank you, Megan. And I mean, even ballpark would be very helpful. Are we talking in the millions and the tens of millions and the hundreds of millions or the billions? And this is going to be something that I would expect that for our board of supervisors, as the political arm of this county organization, can take those numbers to be partners with IGR in advocating for reimbursements and where we can shore up these costs. I have one last question. It's an operational question. So shifting gears from, budget doom and gloom to human doom and gloom. Awesome. This is the committee of awesome. Our health and hospital system has been very front and center across the board for everybody right now. And I know that our capacities, we're at pretty near full capacity as is on a good day, right? And so with our patient census being near full, with hospital beds being filled as is already, I'm curious to understand, what is the plan? Like, how do we, in leading up to the games, what do we do to make sure that we have enough beds? How do we create more beds? Where do we add more beds? Really would like to understand that part of your world.
Yes, that's a great question. As part of our emergency operations plan, we do have a surge plan that is focused on situations like this. We have a surge plan that really looks at how we can expand patient care into non-traditional areas like conference rooms or empty hallways or outside treatment areas. We have a plan to look at our supplies, our excess supplies. We have emergency contacts to be able to get mass supplies or pharmaceutical supplies. We have direct disaster lines that we can call if we needed to order more supplies. We work with our medical staff to work on patient flow, discharge policies, to really increase and speed up discharges if we can. So all of that is part of our surge plan and part of our preparation. And we will certainly look at that and refresh that with all of our staff, our nurse managers, our medical staff, to make sure that everybody is aware of that surge plan and that if it does happen, hopefully it doesn't happen, but if it does happen, we are prepared and ready to activate that plan across all 4 of our hospitals. So it's different and unique for each location. So we really have to individualize it and work with each hospital.
Thank you, Sheila. And for clarification for the record, because this is a recorded and broadcasted meeting, I would expect members of the public may be listening or leaning into this. I want to make sure that the distinction of speeding up discharges, right?
Yes.
Is really based on operational efficiencies and not the well-being of the patient themselves.
Absolutely. I apologize if I misconstrued that, but it is just full for operational processes. To every patient will be reviewed and evaluated and make sure that they will be in the proper form to be able to be discharged. But yeah, absolutely.
Yeah,
It will
thank you,
just be
Sheila.
an
No,
operational
I
flow.
understood it, but I think within county speak, we want to make sure for the public record that no patient will be discharged prematurely for the sake of creating bed space for future scenarios. It's really focusing on the efficiencies of the operations to cut the in-between time, the service time, but not so much the patient well-being.
No.
No, that's not, yeah, thank you, Sheila. You said it perfectly. I just want to make sure it's clear for the record.
Yeah.
Thank you.
Thank you.
Half-truth, that was my last question for our operations, for our medical system. I do see our IGR team in the back there. It's okay, I'm not calling on you, just putting this out there. Just for, this is an ongoing conversation in terms of immigration response and immigrant protections. There has been overtures made in very public settings by our federal administration to send ICE to our games, to our community, to the Super Bowl. And that's something that I want to call out here, that this is something that we continue to think about as a county organization. And I guess, Dana, in the event, in a worst-case scenario where there is ICE activities to the scale that we've seen in LA, or in Portland, or in Chicago, happening during this time of sports, what is the role of the county in that situation? Is there anything, just would love to get your initial thoughts on that. Or Sheriff, sorry.
And I think the undersheriff would like to speak to that.
Thank you. Good afternoon, Supervisor Duong and Allenberg. Our role is basically to serve as mutual aid coordinators for the county. Our role is to preserve the peace and the ability for people to voice their thoughts and opinions about whatever is happening in the world. Obviously, for the Super Bowl and for FIFA, those are extremely large events. So we always have to be mindful of how do we want to provide our resources? How do we want to deploy our resources? And so we're going to have to think very hard about that, because obviously we have no control over the actual game per se. Our concern is going to be for the communities, right? So for example, our transportation system, our communities in the East Side, Central, and South County. So we definitely have certain responsibilities as a law enforcement agency to respond when people need assistance for both the public as well as our federal partners, and to maintain the peace. We definitely cannot impede actions of federal agents. but we can prevent any type of violence that may occur due to, different things that could happen in those types of events, as we've seen in Los Angeles and other parts of the country.
Thank you. So I'm hearing there is a coordinated response with other law enforcement agencies in these settings, in these situations.
There would be a coordinated response if there was a mutual aid request, for example. So if there was a request from, say, City of San Jose, and they're seeing large protests, and they're asking for assistance, then our office would definitely provide that assistance. So we would reach out to Region 2 partners for assistance if they needed.
Thank you, Undersheriff. I know earlier in this discussion, we talk about our jobs being the jobs to worry, but really your jobs are the ones that truly have to worry around the clock and prepare and respond to that in real time. So thank you for today's presentation. Make a motion to receive the report with the request for a report back from the CEO's office on the fiscal implications of relating to the preparations and safety response of the year of sports games next year. And how that will impact the general fund, with what opportunities we have for reimbursements or for advocacy to seek additional revenue sources to shore up those expenditures, with an additional request that our IGR office is also helping with that. Would love to hear you weigh in terms of if there's any advocacy, legislative advocacy opportunities to be able to cover our costs, and also what can be done in terms of, I'm going to add in DSJ here too, in terms of in preparation for the games, what our immigration response plan can look like in those settings.
Understood.
Happy to second that. Thank you so much.
Vice Chairperson Ellenberg.
Yes.
Chairperson Young.
Yes.
Motion carries. Thank you.
Thank you so much for your presentations and for your good work.
Yes, and thank you, everyone.
Could I ask just Michael, right, from EMS? You don't have to answer it now, but I texted my staff when you said 11 emergency rooms. I thought we had 10 hospitals, and I can't count to 11 with the emergency rooms. Could you send me, or to Alex on my team, a list?
11 hospitals.
We have
Because
11.
of Lucille Packard is not a receiving emergency department.
But we count that as a separate hospital from Stanford?
Yes.
That's how we get to 11?
Yes.
Thank you.
Okay, up next is item 5, which is to receive management audit of County of Santa Clara countywide utilities from the Management Audit Division and provide direction regarding the recommendations. Hi, Cheryl. Thank you for being here, and please, you may proceed with your presentation whenever you're ready.
Okay. Good afternoon. I'm Cheryl Solov. I'm the Management Audit Manager for the Board of Supervisors, and I have with me Sarah Connor, who was the project manager for the utilities audit, and Anna Ferrari, who also provided a key analysis on the assignment. This was an audit of utilities across the county, primarily electricity, natural gas, garbage, and water. So I'll just briefly highlight the main findings. We had 6 finding areas. The first being, in a nutshell, we found really inefficient processes associated with utility bill management by the Santa Clara Valley healthcare system, and resulting in PG&E repeatedly threatening to shut off the hospital system's utilities for non-payment of millions of dollars of bills. And also there was nobody really assigned to ensure optimal rates. So we recommended that the hospitals and clinics be enrolled in paperless billing, and that the numerous utility accounts be consolidated with one account for each hospital, and another account that would include all of the clinics. And that the hospital system develop procedures for handling the bills, and also that it fill the budgeted and funded utility manager position. The second finding relates to the county facilities sustainability group, which we found to be engaged in performing tasks that reduce its ability to advance countywide sustainability goals. For example, the sustainability folks were coordinating electronic vehicle port repairs between the EV vendor and building operations staff, and parking work and that sort of thing. So our recommendations were to integrate sustainable components into the county's projects, and to have the administration had either agreed to or proposed alternative recommendations that we think are suitable. The third area that we looked at was the solar energy bonds, which the county used to further its sustainability goals, to have solar power. But in 5 out of the 6 solar sites that were built between 2017 and 2018, they generated less energy than was expected and less savings than was expected, resulting in increased reliance on the general fund to repay the bonds. The unreimbursed debt service payments by the general fund amounted to more than $5 million as of fiscal year 22-23. And we also found that remote sites for the solar installations have been vulnerable to thefts. As of today, based on conversations with the administration, we understand that they're on the brink of deploying some better security at these facilities, and there's new fencing at Hellier. So between that and we think that is, well, we haven't verified it. Reportedly, we think this has been resolved, and so that sort of eliminates the recommendation 3.1 that was directed to the board. And in terms of recommendation 3.4, which was to increase the cleaning of the solar arrays, they're now being cleaned twice a year instead of once a year, but we think that there might be more need to clean them in the summertime to generate more electricity from those facilities, just because in the summer it's dusty and more likely to be for dirt to be blocking the solar power that can be produced from these facilities. Moving on to item 4 and our findings. There was a power outage from PG&E in September of 2022 in which the backup generators at Valley Medical Center failed, and that disrupted hospital operations. So following that, there were continuity of operations assessments that were conducted, resulting in recommendations for about $300 million worth of infrastructure and power system upgrades. But we did not find either short-term or long-term plans to address these issues, and so we had made a recommendation to ensure that there are short and long-term plans laid out for this, and which the administration agreed to those recommendations, and we also recommended that the board not approve funding for these if there were no sound plans developed to carry these out. So, finding 5 is that as of 22-23, the county general fund had been paying about $1 million a year for the utilities for 3 facilities that were entirely occupied by Santa Clara Valley Healthcare. And so then this money was then being reimbursed through the cost plan, but because it was flowing through the cost plan, that increases the cost to the hospital system to have to pay the overhead. So that's increasing the hospital system's cost by about $100,000 per year in overhead. So we made recommendations to reduce this inefficiency of utility payments coming from the general fund to come directly from the hospital system to reduce their overhead costs. And finally, looking at the general budget, and we've seen that hospital utility costs had increased to about $24 million in 22-23, and that the budgets for these utilities were not keeping pace with the actual expenditures, and that there's a persistent and widening gap between budgeted and actual costs for these utilities. So this gets back to the issue of there being there is a budgeted, funded utility manager position in the hospital system budget, but it's vacant. And based on the response that we got to the audit, they said they were not planning to fill it due to financial reasons. And that's it in a nutshell.
Thank you, Cheryl, for the presentation. Thank you to your team for the good work. I'm going to turn to Vice Chair Ellenberg for any questions or discussion.
Yeah, Megan, are you prepared in James' absence to talk about the administration's response? I know there were a couple of points of...
Certainly, and we have representatives from a number of the departments. I see Jeff Draper here, I see Vinod Sharma. I'm not sure, you're welcome to also come down to the table if there's specific questions. And also, I don't know if I'm exercising my past life as clerk, but do we need to see if there's any public comment before we...
Good plan.
Before we start?
There are no requests to speak.
Thank you.
Excellent clerking by both of you.
But anyway, between myself and the folks representing our departments, I think we are prepared to speak to the recommendations. And I just want to start by saying thank you. I know our county executive read this top to bottom, and he and I actually had a chance to talk about the findings and sort of where we go from here. And piggybacking off of your comment about this being the awesome committee, utility bills, it's like very, very important stuff that, people don't necessarily see as the most exciting thing, but as I think, the auditor and as our staff know, it's like this is just, this is the critical bread and butter things that allow us to provide the services that we need to provide. So we're all ears and happy to have a conversation.
Thank you. Utilities may not be a sexy topic, but it is a huge expense county-wide, and certainly making sure that we are using all the business terms, optimizing and consolidating and negotiating to get the very best prices that we can, and also making sure that we're not getting distracted by great ideas if they're not really producing savings. And I would look to the solar as one of those. I'm sure it's something that was broadly championed, but we really have to be ruthless in focusing on what works, what produces savings. And again, this is this is true regardless of our particular budget system, and certainly adjusting utility bills is not going to close a $660 million or billion-dollar hole, but literally all the drops will make a difference. So I'm interested to know where you think the strongest opportunities are for greater efficiency and just less redundancy in our billing and procurement of utility systems.
Thank you for the question, Supervisor Ellenberg. Jeff Draper from the Facilities and Fleet Department here. Actually, I wouldn't give up on solar as an option, and the reason...
I wasn't saying give up on it.
Right.
Let me just
I
make
would
that
just say
clear in a public meeting.
A little bit of history on that particular, the clean renewable energy bill projects. This auditor was perfectly right in terms of the ability to get those solar panels clean during the summertime as well as other times so that we're maximizing production. We are in the process of hiring a new maintenance team to take care of that particular problem, and we will be increasing the frequency as suggested.
Right.
And the reason that it looks like the bonds are being paid back more slowly is because the original bond timing and the payments for bonds was ahead of the construction and delivery of the actual projects. So we fell behind by about $3 million at the beginning, and now we're catching up. Those solar panels will produce well beyond the bond period, and you will get your money back and more over time.
Love that. Thank you.
So it's going to be a good outcome in the end. The other thing, a good piece of that $5 million too was related to the damage that was mentioned at one of our solar fields, and we've just put that solar field back into power.
Great.
And the auditor was correct. We're rolling out some security measures relatively soon, maybe by tomorrow even, that are ready to be positioned to help us not go through a vandalism situation again that we had in that particular case. So that would be on the solar field. Don't give up on solar is my message.
I am so happy to not give up on solar.
In terms of, we have a large amount of buying power, as you've mentioned. We have a significant utility bill. We do reach out to our different utilities, and we do try to obviously we have to work through the CPUC to do our rate intervention, if you will.
Mm-hmm.
So we could do more rate intervention effort, in my view, as a public entity through the CPUC processes. And I think that could give us an angle in terms of trying to keep our bill in check as much as possible, if you will.
And do we use electronic billing, or are we really still?
We do use electronic billing in Facilities and Fleet. I think the hospital is shifting that direction, right, Vinod?
Good afternoon. Can you hear me?
Yes.
Good afternoon, Supervisors. Vinod Sharma, CFO for the Health and Hospital System. Yes, we are moving towards consolidation. We'll be working with the Facilities Department to make sure whatever bills could be consolidated will be consolidated, electronically received, and wherever possible that they need to be kept separate because we need to track cost by location and budget by location, we will do that. But overall goal, and this is not just utilities, but everything else we are working on in the hospital is to optimize whatever processes we can to optimize the use of resource. I keep using optimizing and reducing the costs, and that's what the goal is. And so certainly the electronic consolidation of bills is a first priority, but also make sure that we don't lose sight of tracking of the budget and the spending at the site level.
Supervisor, I'd also add in, Vinod led a Procurement America process, which was the Procure America process, which was individual audit by our accounts by an outside entity, a third party, and with the idea that there would be savings and they would be sharing in the cost savings going forward. And they did find some cost savings, and we do those kind of analyses on a regular basis. So we're always looking for places that we can save money.
Right, I understand their utility analysis resulted in about $750,000 in savings, and they did a project, I think they did some work with TSS and found a couple $1 million in savings.
Yes, they did the project with TSS.
2.2 million
and,
from
on
the TSS.
telecommunication, yeah.
Yeah, I know about Procure America. My understanding is that the experience has been good. I'm certainly not advocating for one particular vendor over another, but to the extent that we can enter into partnerships where we literally pay a part of the savings as opposed to, big upfront or contracting costs, to me that seems like a real ideal pairing that we should lean into wherever we can. I'd like to get, and I'll make my motion to receive the report, and I'd like to get an update back to this committee in 6 months. That's 6 months on the progress that has been made on each of the recommendations, and where there is disagreement between administration and Harvey Rose, such that you're choosing not to implement a recommendation, an update of whether you still maintain that position or that there is opportunity to do better and find more savings.
Yes, one last comment on the Procure America is, yes, there are savings, but I'm also asking them to quantify so I can validate it on month-to-month basis that actually the savings are there.
Fantastic,
Because
yes.
with thousands of lines, it becomes sometimes difficult.
Oh, I agree. We need to be able to measure exactly. Thank you.
Thank you.
And we'll look for a second.
Happy to second the motion. And I do have some questions for the discussion that I know that the 2 recommendations for the board are now really one, since the other recommendation was approved to install security cameras. But for the remaining recommendation, 4.4, Cheryl, I'd love to hear from staff as well. What is the upside and downside of enacting this recommendation?
This recommendation was to wait for appropriate planning prior to funding hundreds of millions of dollars in upgrades. So there's a history here of what's the term? Plans that are not robust for capital projects and upgrades. So we felt that if we could have the board use its authority, that would result in better planning. Because if there's no decision to appropriate funds for projects for which there are not plans, that might result in better plans.
That was super diplomatic of you. Sorry, it's your time, but I saw you leaning in, Megan, and I understand the tension there, but she also raises an excellent point that we don't do we don't do what doesn't have a specific plan and money attached to it.
And I just was going to say, I think we take this recommendation seriously. I think as the board is aware, and even at the conversation that occurred recently, about funding capital programs and looking, we're looking at this differently and trying to have some different approaches to some of this. These projects that require, more detailed and analysis. So, again, hear the feedback.
And part of
funding is the board's discretion, and so I think we can just continue to raise this up when it comes forward.
When the report comes back in 6 months, it should have specific plans attached to it. I fully realize there may not be money, but I want to know what implementation would look like and what the barriers are. Is it that you just don't have funding to do this? Are there other barriers? I mean, more money isn't always the solution, but certainly a concrete plan from here to goal is important.
And I think we may be able to point to where that plan would come forward as part of another process. So I will look to make sure that happens.
I don't know what that meant. Part of another process. I want to see it here.
Well, there's two things I would offer. One is in terms of the plan, the actual continuity of operation study that was done did everything soup to nuts to identify all weak points, not necessarily just in the electrical system, but into several other systems as well. And in that plan, or in that study, it does actually outline which ones are more critical. It's layered in terms of which ones are more critical, which ones are medium priority, which ones are lesser priority. So
Sure, those aren't plans, though. That's
I know,
not.
I know that, but now we can take the next level and
Okay.
put together the plan and provide that to the county executive for consideration as part of the ongoing capital improvement program development.
Thank you. Thank you for letting me jump back in there.
No, totally. I mean, it's an organic conversation. So Cheryl, with recommendation 4.4 being presented, asking for direction for the boards, seeking direction from this committee to the Board of Supervisors. I guess I turn to you and to you, Megan, in terms of, is that something that we should wait on for the report to come back, or would there be more information for us to determine the recommendation, and whether we forward this to the full board with a recommendation to support it or to implement this recommendation?
I mean, I think the opportunity, what I hear, and Supervisor Ellenberg can correct me if I'm wrong, but in 6 months, we can come back and explain where those, and I'm sorry, Supervisor, if I wasn't more clear earlier, but the opportunities to fund the projects that are part of this plan will become, where they will be coming forward as part of like a capital improvement process or not. I think that would be the part. So and again, Cheryl, I'm looking at you because this is your recommendation, but when you say like decline to approve any additional funding, that's really down the line when we come forward with what the actual projects are. So, but I think we can maybe be a little bit more tidy in sort of explaining this process in 6 months to really foreshadow where those opportunities would be for the board to exercise its funding discretion.
Are utilities a capital improvement project that may not happen for a while? I see these as real immediate
Well,
needs.
we're working within the OSHPOD world of the hospital, planning and development world. And so that takes time in and of itself. Everything requires a design and formal processes when we actually get into the project. So that's where the time is usually expended in design and permitting.
So maybe I'm talking about something else, not a new project. That is separate, and I appreciate that. I'm talking about what we are doing to increase efficiencies, streamline billings, do the things that are within our control now in a better, more cost-effective way. I'm not talking about improvements down the line. I'm sorry if I wasn't clear.
Now, we're implementing everything that the auditor recommended as quickly as possible, and the finding efficiencies does not require an HCI permit unless we're putting in infrastructure.
That's what I thought. So that's what I'm specifically interested in relative to this item and seeing an update on in 6 months.
Okay, understood.
Okay, so no amendments to the motion is necessary, and I think we're ready to go to a vote. Thank you.
All right, Vice Chairperson Ellenberg.
Yes.
And Chairperson Young.
Yes.
Motion carries.
Thank you, everyone. Okay, at this time, we will move to item 6 on our agenda, and that is to receive semi-annual report from the Department of Aging and Adult Services, Social Services Agency, relating to the in-home supportive services call center and overdue reassessments. Hi, Vanessa. Thank you. Whenever you and your team or your colleague is ready to present, please proceed.
Good afternoon. Vanessa Merlano, Director of the Department of Aging and Adult Services with the Social Services Agency. Joining me today is Michelle Finley, the newly appointed Senior Manager overseeing the IHSS program for our department. Again, good afternoon, Chair Young and Vice Chair Ellenberg. I would like to provide some updates since the department last submitted this report. The first thing is I'm going to sunshine one of the data points that was in the report, but we're very excited to highlight that again today. So as of August 2025, our quality improvement action plan requirement that was imposed on us by the state has been removed. So this really allows the program to focus on operational efficiencies and really meeting the needs of the community by meeting reassessment rates. So we're really excited to be able to report on that. An update, one of the other updates is that the department's timely overall reassessment compliance rate has reached 86.43%. I just want to note that this is the highest level of compliance that we've had in the past 10 years. So really excited to report on that. A couple of other updates. Currently, IHSS has only 13 referrals pending, and that is one of the metrics that we were reporting out as well, that are beyond 90 days. Out of the 1,580 total referrals pending, we are well within our goal of completing those within the 90 days. And the last but not least note is that our community first choice option cases, these are unique cases within the IHSS program, are performing exceptionally well. And they are at a 96.11 compliance rate. Our requirement is to be at 100%, and we're well on our way to be in compliance by the end of this calendar year. And with that, I'll turn it over to the committee for any questions.
Thank you. Turning to my vice chair for any questions. Oh, hold on. I'm going to get it. I'm going to turn to clerk to see if there are any public comments.
There are no requests to speak.
And I'll turn to vice chair.
Congratulations. It is so wonderful to hear any happy news these days, but you really do have some things to be very proud of, no longer being under the Quality Improvement Action Plan. The high rate of compliance is impressive, and also just noting the continuous quality improvement partnership between IHSS and SSA. Can you say a little bit about the dashboard to monitor compliance mandates? What is that? Who should be looking at that dashboard? Who's the intended audience?
Yeah, absolutely. I think there are multiple intended audiences for that, but let me just clarify what we meant by that dashboard.
Mm-hmm.
The IHSS program is a program that implements data into a system called CMIPS that is managed and operated by the state. Prior to Ms. Finley joining the team, we relied on the state to provide us this data, and the data was provided 45 days out. So, for instance, if we were looking at getting real-time data for November or October, we would have to wait until November 15th to see that actualized data. And so what the team has done is they've pulled together with our CQI partners and our TSS partners to actually get the data directly from CMIPS, pull that data real time so that we can operationalize efficiencies and make changes to operations in a timely manner to effectuate the change that we want to see in operations. And so who's that data for? A lot of the data is for internal operations, but certainly a lot of this data can be used to see in real time how quickly we're making an impact and improving the systems at IHSS.
Could you, I'm sorry, I'm sure this is so basic to your work, but I'm looking for something a little bit tangible. Could you just kind of give me a hypothetical example of a kind of change that would be implemented based on this data? Changes in programming, changes in billing, changes in personnel? I'm just not sure.
So let's talk about the way that we've been pulling together the reassessments. So at the start of the summer, we were somewhere around 5,000 in overdue CIFCO reassessments. One of the ways that we're really centralizing and coordinating data is now, instead of having those cases remain within the units, we pull the cases into one centralized polling system, use the data to then distribute those reassessments timely across our units so that we can have assessments done in real time, completed in that month. And so our reassessment rate that you see and that compliance rate that you see at the state goes up because as of the result of using that data.
Thank you so much. That really helps me understand I know the numbers are good, but I would like to actually intelligently understand why they're good. So thank you so much.
Thank you for the
And I'm
question.
happy to move receipt of the report.
Second, congratulations, Vanessa. Really well done under your leadership, and thank you for the work. Ms. Finley, right? Thank you, Ms. Finley.
Vice Chairperson Ellenberg.
Yes.
And Chairperson Young.
Yes.
Motion carries.
Thank you. Up next is item 7, which is to receive report from the Office of the County Executive relating to state legislation and suggested edits to the 2026 legislative policies and the Finance and Government Operations chapter. Welcome, Elaine and Monica. You may proceed with your presentation whenever you're ready.
Good afternoon, Madam Chair, Chair Young, Vice Chair Ellenberg, David Campos, Deputy County Executive, and I'll turn it over to our staff to introduce themselves.
Good afternoon, Chair and Vice Chair Monica Tong, Intergovernmental Relations.
Good afternoon, Elaine Trin, Intergovernmental Relations.
Good afternoon. Thank you for the opportunity to present. Today we will be talking about the 2026 legislative policies document, which, as you will hear in the presentation, is one piece of a larger legislative platform. But the legislative policies document is a document that really provides guidance to the Intergovernmental Relations Office on how to approach all the bills that go through the state and federal legislative bodies. Instead of coming to the board every time that one of those bills is introduced, because there are thousands of them, this document lays out your position as a Board of Supervisors on a whole range of issues. I will say that we have spent a lot of time reviewing this document. I know that one supervisor perhaps wasn't in office yet when we did this, but we did a very comprehensive overhaul and review of this document over a year ago, which was the first time that this document had actually gone through that extensive review. And then because so much has happened at the federal level in the last few months, we have asked departments to go with a very fine lens in looking to see if, in light of all the changes at the federal level, are there additions, subtractions, or anything else that should be modified or added to this document. And with that in mind, we want to thank the departments, many of which are here in the audience in case there are questions, some that might be online, for their engagement, for their involvement in reviewing this document. We also want to thank County Council. And we go to every committee because the document is organized by policy committee, each one of the 5 policy committees of the Board of Supervisors. So with that, I will turn it over to Monica.
Thanks, David. As David just mentioned, the legislative platform is made up of 4 different pieces. The policies document that David is referring to are bill concepts, priorities, and funding that will all come to you on November 4th to the full board. I will be providing the semi-annual report on bills. We were previously reported to the committee in May, and additional bills we've engaged since then. Please note, and I make this caveat every time we're here, the report is a point in time, and I'll be providing the update orally. This year, as approved by our board, the county sponsored 3 bills and co-sponsored 2 other bills. The state legislature did wrap its 2025 session on September 13th, and the governor had until October 13th to sign bills presented to him. The information here includes AB 243 and SB 261, which were signed by the governor. So we're very grateful for that. AB 1025 was held in appropriations. SB 33 is a 2-year bill, so we will be continuing our work with Senator Cortese on his GBI bill next year. And AB 632 was vetoed by the governor, citing legislation that was recently enacted that provides government agencies tools for enforcement. And on to bills that we engaged in the FGO space. AB 339 was signed by the governor on October 13th. AB 1275 was also signed on October 10th. SB 162, one of the Senate budget trailer bills, was signed into law on September 17th. And SB 346 that we worked on in partnership with the Department of Tax and Collections was signed into law on October 13th. Additionally, want to make mention that Senator Razzo's SB 707 was signed into law in early October. I will now turn it over to Elaine.
This slide shows the timeline for our process for updating the legislative policies document as well as our legislative platform. Once again, I want to thank the department directors and executives behind us for supporting us with this work. We met with many of them early in June, and now we are in the process of going to each board policy committee, as David mentioned, and then we will be going to the full board November 4th. Just to reiterate, the policies document is divided into the 5 board policy committees. It provides IGR the guidance to engage on many of the bills that are introduced, as Monica just indicated, with some of the bills that we've engaged in the FGO space, as well as our legislative or our sponsored bills. So just a quick overview of our suggested edits to the legislative policies document. As David mentioned, departments did go through the document and ensure that our statements were updated to reflect the evolving landscape of the state and federal government, just to ensure that we have the authority to engage in legislation if and when it does come up. So there was a lot of additions of new statements or clarifying statements, as well as deletion of statements that were obsolete. And as part of the legislative file, you have the red line document, and then I will turn it back to David.
Thank you very much, Monica and Elaine. And again, thank you to all the departments that have engaged in this process. We have, again, made sure that we take into account all of the actions of the federal government to make sure that we have the flexibility and the language in these policies to take immediate action as needed in Sacramento and in Washington, D.C. So with that, I will turn it over back to you, Madam Chair and Madam Vice Chair, to see if you have any questions for us.
I'm going to turn to Colin to see if there are any public comments on this item.
There are no requests to speak.
Thank you. Turning to my Vice Chair, if there's any questions or points of discussion.
Thank you all very much. I want to just hit 2 different areas. I appreciate and support these updates. Just a quick question about the carrier of last resort. What do you see happening now? Is there still a possibility that AT&T could successfully petition themselves to alleviate this responsibility? And what is the conversation that you're hearing?
Thank you for the question. Related to AB 470 from this year, it was held in appropriations, but the word on the street is that they will continue working on that next year. It is also my understanding that this is still in process at the CPUC. So I believe.
Yeah, there must be a plan B. I mean, we have rural residents, but compared to the rural counties where all of the residents could be at risk, like how do you communicate if there's a cell or internet service goes down? It just seems so irresponsible and so unsafe to not have a reliable, consistent plan in place. If there's anything you need here from our end, I imagine that RCRC is leading the charge on this. Is that correct?
They were engaged on the bill, as were CSAC. The last set of amendments that AT&T took before the bill was held did require a minimum of 3 options for households. So that did remove some of the folks in opposition, but not all.
Okay.
And now that the bill has been held, we will continue monitoring that and can keep you apprised of what's happening.
Thank you. I would think that even in this budget year, that's a bill that should be able to keep going because it doesn't have, for the state budget, it doesn't have significant financial implications, correct?
That is my understanding. The Appropriations Committee is a place where there are often mostly cost concerns, but can have some policy implications as well.
Right. But I think that's what I'm trying to say, that this is not a bill that has significant appropriation concerns.
Understood.
If I may add, through the chair, Madam Vice Chair, I think that what we have seen, and I think the reason why you see this continued effort by AT&T is that, from what we have gathered, there has been a change in leadership in this company, and so direction is coming from the East Coast for them to be as aggressive as they can be, and you have sort of a large MAGA presence in the leadership of that company that is directing, and I think that they're about to learn that things are a little different in California. You would think that they would know that by now, but we'll see how this unfolds. But we remain committed to continuing to watch this and making sure that the interests of all of our residents are protected in this effort.
Thank you so much. Do we have I'm sorry, this is probably information that's available that I just missed. Do we know about how many residents are potentially impacted in our county?
We do know that. I don't know that off the top of my head. We can get that to you.
Sure, just off agenda or an email is fine.
Great.
Thank you so much. I wanted to just ask a little bit about AI as well. That's certainly been a growing topic of bills and legislation. I know the National Association of Counties is holding some classes that a couple of my staff members are participating in around AI use in government. Hello. But this is such an opportune moment where we can really look, certainly not for purposes of reducing our workforce, but for making our workforce more efficient, more productive with their days. That would seem to be in everyone's interest right now, and I know that we have lots of privacy concerns and security concerns, but is there kind of a strategic plan or a goal of how far we should and want to and can go in AI, and what does that look like in a very constrained budget period?
Thank you, Supervisor, for the question. And for the record, my name is Chris Paul, and I'm the county's privacy officer, and I co-lead the Generative AI Committee, which our executive sponsor is Deputy County Executive Megan Doyle. We are looking at generative AI in the broadest context and also in the department context as well, really focusing on lower risk items where we can look at more routine tasks, such as looking at summarizing many documents, maybe looking at how we can write some emails externally, how we update our website. But we do have a strategy that I would be happy to talk with you or submit to you offline and go into a little bit more detail as well.
Let's set up a meeting. I would like that. And if there's someone on your committee that's particularly focused on the healthcare system, I know I hear doctors often talk about charting and other things that can be done through that work. If there is a different point, an additional point person, I would really appreciate setting that up, please.
And if I may, through the chair, from the IGR perspective, we do believe that there is space for us as a county to be more active and engaged legislatively on this matter, and I know that that's something that we're all discussing and working on.
I think
As
we
you
need
know,
to
the
be.
city of San Jose and the mayor of San Jose are very active in this space, and I do think that there's an opportunity for the county to play a much active role. And so
Sure,
we're
I
working on that.
imagine that's true with cities up and down the state. There are so many applications, but there's absolutely room and an important place for counties at the table as well. So thank you, and my team will reach out to you, Chris, to schedule some time to talk more. Thank you.
Thank you. Sorry, David.
Can I make a motion? I can move receipt of the report.
Sure. Second. David, sorry, I didn't see you earlier, so when I was introducing your team, I failed to also introduce you. Thank you so much for being here with us. Just want to say congratulations on a number of bills that we co-sponsored that have made it to the governor's desk and signed into law. Special shout out to Assemblymember Patrick Aarons and AB 243, and also to SB 261, sponsored by brought by Senator Wahab. It's going to really significantly impact our ability to serve our most vulnerable here in our county. And I just want to give you a shout out to, I know this is from a different previous committee meeting in a different committee, but it's all public record now, so there's no cross-referencing here that would, but just, and CSFC, I made a last-minute request because it came to me, to my knowledge later, randomly in community, but Assembly Bill 1261 to provide legal representation for undocumented minors in immigration proceedings. Your team, David, got the letter of support out, I think, that night, and it's been signed into law since then. So just thank you for your good work and your diligence. There's no shortage of crisis and necessity for good legislation to happen right now to course correct the world, and I appreciate your work. Thank you. Colin, I think with that, we're ready to vote.
Vice Chairperson Ellenberg.
Yes.
And Chairperson Yoon.
Yes.
Motion carries.
And up next is item 9. And back to my agenda here.
Item 9 is the regular behavioral health facilities expansion effort. We do receive this report every month. It's a great opportunity to regularly track what that expansion looks like. And as of now, we're up to 228 beds, which is very exciting. The question that I wanted to ask today, Key, and thank you for coming down, is around the status of the BH CHIP Round 2 Prop 1 applications. I know we consolidated our list of applications following a board vote, and the direction was to look for letters of support from the San Jose mayor and any other relevant elected officials. Could you provide an update on that?
Sure. On September 30th, we made a request to submit 4 applications to the state. The board approved 3 of those. For all 3 projects, we have received somewhere between 6 to 8 letters of support, with a few outstanding. The subacute facility in Morgan Hill, that is on track to be submitted by October 28th. The 101 Jose Figueres project, we are working towards submitting an application, or working with partners to submit an application on by October 28th. The last application is for the enhanced STRTP. after consulting with our departments, we believe that, sort of a more expeditious and maybe cost-effective way to achieve and establishing an ESTRTP would to simply either acquire a home or to lease a home.
Less expensive.
The timeline for the application is extensive. It would require a 30-year use restriction for a $2 to $3 million construction project. We believe that just acquiring or leasing a home would better meet the board's objectives.
And we would be able to meet the licensing standards and not have some of the issues we've had in the past with transitional facilities or scattered sites.
For the ESTRTP?
Yeah.
Yes, we would be able to acquire the home, make minor renovations, or lease a home, make minor renovations, and that would be licensed by the state. We also would have the certification from the Department of Healthcare Services to provide the outpatient services there.
Great. So 2 of the remaining projects are in San Jose. 1 is in Morgan Hill. You answered me broadly that we've got a number of letters of support, but I am just interested to know if we have them from the Morgan Hill mayor and from the San Jose mayor for the projects that are in their cities.
For all projects, we actually have them from the San Jose mayor
Fantastic.
and the Councilmember Ortiz's office for the 101 Jose Figueres project. For the Morgan Hill project, we do not have letters of support at this time from the Morgan Hill Council.
Okay, maybe we can help with that. The deadline to submit is next week, and be sure to thank our colleagues in San Jose for their support. Thank you so much. I appreciate the quick update, and I'm happy to move receipt of the report.
Happy to second the motion and also express my appreciation to you, Key, and your team for moving these really hard pieces forward. Thank you.
Yeah, amazing.
There are no requests to speak. Vice Chairperson Ellenberg.
Yes.
And Chairperson Young.
Yes.
Motion carries. Thank you.
Okay. All right. I think at this time, that is it for our agenda. We will now adjourn the meeting to our next regular meeting on November 6th, 2025 at 2 p.m. in the same Board of Chambers. So meeting is adjourned. Thank you, everyone.